we really want to close with the connection of mind, body, and spirit, and how finding the balance of all that every day as a daily practice is what is going to be our greatest curative. So I want to welcome, please, Dr. Tia Trivisonno.
Honored to be here. Thank you.
Lovely to have you here.
So happy to be here. Thank you so much.
Okay, so I think we've done a master class where it was all about mind, body, and spirit. That is the secret sauce, is it not? And, it's not like we're saying something new, but it's new in Western culture because we just lost that indigenous wisdom, right?
We sure did.
So tell us how you got on this path and, how you practice it to help people get well.
Absolutely. So, like many of us here who are either practitioners or people who are on a health journey, I myself, pain nourishes courage. And I think we're being marketed that pain should not exist. And as a matter of fact, physical and emotional pain is really what ignites the process of transformation. So we're here to talk about the reversibility of chronic illness. So I have my butterfly here because, of course, it is from darkness out into light. So I was fairly young when my father got ill, and I was a daddy's girl for sure. He was my hero, big personality, very protective, amazing, bright person who started to suffer with heart and kidney disease, and we were taking him to all these different specialists, and he was getting bounced around, and a lot of conflicting treatment options, a lot of, don't do this diet-wise, do this, and what we could really see is he was just suffering in the process, and as he unfortunately started to kind of fade away, and ultimately we lost him when I was 20, I just remember my mother saying, I wish there was a person who could treat the whole person. And I said, there has to be that. I'm sure there is. And so I just started reading books and learning and kind of digging into what was out there. Indigenous medicine. I was a Peace Corps volunteer. I learned a lot about environmental sustainability and just kind of kept learning more and more and found naturopathic medicine and Chinese medicine. And so now I'm an acupuncturist. As Dr. Curatola mentioned, we met in Germany at biologic medicine conferences. So I've really been blessed to have so many mentors and friends really in the top, what I consider to be the top tier of all of the types of medicine that are out there, because that's what we really need is a cooperative paradigm of care, not one that says this is better than that or you should do this and ignore that, because we have to empower ourselves.
Absolutely. And how did, you mentioned that you had gotten into acupuncture. Mm-hmm. So why did that field speak to you, and what is the mechanism of that you felt you wanted to participate in?
I love acupuncture. Actually, my father and my grandfather, I'm half Italian, and they kind of had some connection to just older ways of doing things. We're very open-minded to different types of therapeutics. So he had gone for acupuncture. I went myself, oddly enough, for gut issues and skin rashes, which is not what they talk about when they talk about pain, and that makes sense. But I started to experience the benefit of it, and every single day I am humbled by the amazing power of acupuncture to heal. So in the naturopathic medical program that I was in, they offered a master's in Oriental medicine as well as the acupuncture. And so I was going to Chinese doctors for self-care while I was in, a pretty intense graduate program. And that's what kind of kept me level. And so I was doing that as a treatment. And I still go myself for acupuncture every 3 weeks to another acupuncturist, even though I can do it myself.
So 3 weeks, you think, is the sweet spot for?
For me, I like it that way. Really, it's a rhythmic pattern, and it depends on what's going on for you. So if it's something acute, you may want to come a little more frequently. I say about after 4 to 6 treatments, you should know where you're at, and then we can figure out a timeline. It just should be something on like a rhythmic.
And what is the spectrum of parts of the body and diseases that it supports?
Everything.
Really?
Absolutely everything. Whether it's just supporting from a symptom picture when you are going through other types of more invasive therapeutics, but it's literally, insurance companies don't cover if you try to code for, let's say, hypothyroidism and acupuncture, but it certainly works to support the thyroid gland. It works for fertility amazingly well. It's gotten recognition because of keeping people out of back surgery, so pain. But mood, I do a lot with emotional work, as Dr. Kiratola mentioned. So I've worked in a pretty intense psychiatric clinic for several years, and so the vast majority of the patients, when we're titrating off of psychiatric medications and trying to stabilize, we do acupuncture. Yeah.
And so acupuncture is working with the nervous system?
It works with the meridians, which I think many of the people that have been here today have touched on this idea that I look at the body as pipes and electricity ultimately in the house, and you want everything to be open. You know, where there is pain, it means there's no movement going on. So we open, we move, we unblock. This does work on the nervous system as well as the circulatory system, the lymphatic system. But it's not going into a nerve. It's really truly just stimulating a point on the body. The ancient Taoist sages could see the location of the electromagnetic energy grid essentially through meditation, as we've been talking about. So you can see locations, and it's like putting a rock into a still pond. You get a ripple effect of healing and oxygenation and neurotransmitter production and all of these other beautiful chemicals we've talked about today. So it stimulates that. So it's a regulatory therapy that supports bringing the body back into homeostasis.
And as far as emotional health goes, is that a separate kind of therapy? No.
Not necessarily. I combine a lot of different therapeutic techniques. There are different styles of acupuncture that are more, aimed at supporting the emotional, but all of it does.
And do you have an opinion about we're seeing like microdosing of cybacillus. Is that something that you think is worth exploring?
I think it's valuable. There is a trend for that to be coming back, and in a dose-dependent, scenario and under the guidance of somebody that's going to provide counseling and support, the brain can change itself. We're talking about reversibility. We're talking about trauma as one of the underlying things we have to work with. Well, how does one resolve trauma? I mean, you can talk about it all day long. It does not necessarily allow it to leave the building. And so if our cells are vibrating, and I have some slides I'll show you, at a certain frequency where it's holding on to the trauma via the water. We talked about the percentage of water on a cellular level. It's believed we're 99.999% water. So if the vibration is fear, if it's anxiety, if it's these kinds of things, then we're operating from that standpoint. So something like that, that's part of why I think these are coming back, because of course we did use these types of therapies throughout our history and culture, is that it can open up the nerves again so that they can communicate in a new way, and the brain has the opportunity through neuroplasticity to go a different way. If the knee-jerk reaction is anxiety and fear, and then we start to show a new way, I go left instead of going right, then we're sort of using a broader portion of our brain, and we're allowing that trauma to really heal and be released, so it's no longer emotionally charged.
And what do you blame I'm sure a lot of people that come to you are suffering from chronic illness.
Yes, all of them.
So what is your conclusion to why that is? And then how do you help them?
Sure. Well, so I wanted to start with this quotation, just that, your body's ability to heal itself is greater than anyone has permitted you to believe. And the most important thing is that you ask yourself, have I permitted myself to believe that I can heal, right? So, all of the doctors have touched on this today. We have to really check in with ourselves and get honest with where we're at. And when we're inundated with a lot of fear-based information, we're under a paradigm of fear. What do we do? In the case of cancer, of course, sometimes we do make that radical change, but as it was mentioned earlier with Lyme disease or chronic illness, it's a slow process. And I'll have many people come in, I'll say, well, are you bloated? No. oh, okay, so no bloating after you eat? Well, only after I eat. Well, then you are bloated, right? So we're not optimally well. So when we tap into this idea that, and all these words that are in this slide, of course, love, compassion, observing, getting honest is part of this idea of checking in with the idea that we can heal. And we need to believe that. That's very important because we're going to talk about electromagnetic vibrations, frequencies, water, the place where trauma is stored, how to raise our frequency. And I love this one because it is true. There's no substitute for rest. Dr. Tony talked about the meridian time clock. 10 p.m. is where we start to get into the gallbladder, the liver, and the lung where the energy circulates. So those major organs of detoxification do not like to do their work while you're awake. They want you to be sleeping.
And is it better to not have the Wi-Fi on during that window?
It's better to unplug. My kind of mantra when I'm out in the world working with people is, I want you to be able to live in this world. I want you to live well, right? If we get afraid of everything from the Wi-Fi to the woods to the, all of our products that we're using, we can be mindful, which is what you were talking about. Get some sun, put on the hat, sit in the shade, but don't get rid of the sun altogether, right? If you want to go for a walk in the woods, maybe you wear a certain kind of pants and you pull up the socks. And castor oil, I'm going to touch on that later, is one of my favorite things for breaking up biofilms and for lately, it's like a magical thing on so many levels, but lately I even heard that it repels the ticks. So, certain things that you can utilize as protection, so you don't need to hide in your house in a cave, now resonating at the fear-based, vibe that we don't want you because the world is inundating with toxins. So I have an app on my phone from the Environmental Working Group. It actually can scan all of your household products, your sunscreens. It's a huge database. So when I'm shopping around, even just for fun sometimes, I scan different products and it's going to give me a list from green to yellow to red, the level of, potential carcinogen in the product, allergy risk, and all this kind of stuff. It's so easy to use. They've done great work.
Ken Cook has spoke with us many times.
That's great. So, I think that here we, of course, just see the statistics, but you asked me that question, why is everyone chronically ill and what do we do? Chronic illness is on some level difficult to diagnose and complicated to treat because it doesn't fit into the box perfectly of specialty medicine. We've spoken about oncology, we've spoken about dentistry, we've spoken about cardiology, and we've heard this already today. More than one system is involved, but you still must uncover the root. So the root manifests in more than one place in the body, the gut, the brain, the endocrine, the immune, the mood, the muscles, the joints, all of this, but there can be more than one root cause. It could be a pathogen such as HPV in combination with a psycho-emotional trauma in combination with a toxic product. So this is what Dr. Tony talked about when he was saying obstacles to cure. As we remove each obstacle, we uncover the layers of all the different roots. And we need to know that treating the thyroid is part of, it's connected to the gut. It's connected to your big toe, truly. So this is how we look at that. And we need to be able to treat the whole person, and that's where we really need a paradigm shift.
Oh, yeah. Okay. I thought you changed the
I just changed the
screen.
Yeah, I did.
So when we talk about mind, body, and spirit, is there practices that you do for yourself or recommend to your patients to keep those three things in harmony?
Absolutely. So, health empowerment is the biggest piece. And on that first slide, I had a kind of a picture of what I think about, is chronic illness the new modern day plague? The answer is yes. But the good news is we absolutely have solutions, and it's an educated consumer. We've been talking about that all day. It's health empowerment. Health empowerment to me is, you become an educated consumer of medicine. So you use the best of what's out there. It's not getting rid of anything that is there. You understand when to go to the specialist. You use your insurance to maybe cover labs, but you don't expect that one piece to do everything. So working with practitioners, I mentioned part of my own self-care practice is I do go for acupuncture, but prioritizing self-care and taking your own temperature is really truly part of, how do I feel emotionally? Have I gotten enough rest recently? What am I going to do first thing in the morning? So I start my day with some form of movement. Oftentimes I'm in the ocean, I surf, so I get out and I do that, but I walk, I spend time in the sun. Just moving my body. I also do a lot with hydrotherapy, which we're going to talk about a little bit more, and meditation we also spoke about. And we also talked about the idea that meditation can be difficult. We think we're doing it wrong. So sometimes I do a guided meditation where I'm listening and walking at the same time. We're all busy people. So I look at health empowerment as, most of us feel very overwhelmed, and we've been hearing a lot of overwhelming things even today. We're hearing the statistics about cancer, the statistics about chronic illness. That might just make us want to go home and put our feet up and watch TV and not do anything. So making your self-care practice work for you. I even have been doing something recently with yoga where it's 15 minutes. You can make the 15 minutes. You can make it work for you.
Is naturopathic medicine what you wanted for your dad but couldn't find?
Yes, yeah. I didn't even know it existed, to be honest.
Right.
So I've been working with the naturopathic organization to spread awareness in the state of New York, but also throughout the country, because naturopathic doctors are trained as primary care, so we do work with the entire body, but with the least invasive methods first. He got a lot of most invasive methods first. So here, on this slide, just I touch on the idea of how doctors do perpetuate disease. Again, not the doctors we've talked to today, but that there's overprescribing. There's an epidemic of overprescribing. There's misdiagnosis, as you went through in your story. There's diagnosis without safe or effective treatment options. There's too many treatments, but then no diagnosis. It goes on and on. Treating physical complaints with psychiatric medications. This is how the picture gets very mixed up and complicated, and then people end up in the naturopathic doctor's office, often, unfortunately, as the last resort, which I was going to talk a little more, instead of first option, because you don't even know about it. Or the ways, what you said before is so important. How do we empower ourselves every day? What can we do? And I'll as we close up, I'll talk about a couple of those things.
Let's do that.
Yeah, so.
Thank you.
Yeah, absolutely. So oftentimes people at the last stop do end in with, is it all in your head? The psychiatric medications they've been placed on because the chronic illness is unresolved. So we've been talking all day. Good vibes create healthy cells. Dr. Tony spoke about the telomeres and the things that can lengthen the telomeres. Positive thinking has been shown to lengthen telomeres. Your thoughts are things, your thoughts matter, our cells are eavesdropping on the conversation. So if we're sitting here in fear, anxiety, worry, that is kind of where we're gonna be staying, and our body's gonna be responding to that signal. So I wanna change the way we think. Every acute disease is actually a purification. We've been speaking about toxins, but the body is designed for toxins in, toxins out. So we want to support that. And if you never get an acute infection, you never get a cold, that means your body's actually not purging toxins. So there's acute and then there's chronic. We want to encourage the acute to happen, so you purify, so you heal, not Band-Aid it, as you mentioned, and not just come at the germs, because we're working on the whole body and the terrain. So I love the story of this man who's one of the fathers of naturopathic medicine, actually landed in New York, and interestingly, we still don't do a lot in New York, but through hydrotherapy, literally, they signed his death certificate in front of him while he was still alive. He went back to a mentor in Germany. He was from Baden-Baden, where Dr. Jerry Curatola and I met, and just through water cure, different temperatures of water, he was completely healed and cured within, I think it says 4 to 6 weeks or something. So
From what?
miraculous. Tuberculosis, but it was basically he was on his deathbed. So,
Isn't that amazing?
It's so amazing.
There's a lot of breakthrough stuff coming out of Germany. I know Dr. Jimenez goes to Germany quite often and,
Yep.
deals with different learning and discussing groups with other doctors on the cutting edge of things.
Absolutely. And so, we have been speaking about trauma, and I just love this quotation, that trauma decontextualized over time in a person looks like their personality. Over time in a family, it looks like family traits. Over time in a people, decontextualized trauma looks like culture. So we kind of have to think about how our culture may be operating from the standpoint a little bit more of trauma and how we have to work to resolve this trauma. So to speak about water and the things we can do for self-care, for mind, body, medicine, I mentioned this ancient Chinese saying, where there is no movement, there is pain. Where there is movement, there is no pain. The flushing of toxins, the movement of toxins, we can all do this at home. We have a shower, we have a tub, we can go for walks, we can do castor oil packs. Just 10 minutes in a whirlpool has been proven to increase your well-being and decreases anxiety and activates the parasympathetic side of your nervous system. My favorite thing also, castor oil packs does that as well. So these are simple things at home.
So those castor oil packs, so you believe in that?
I do.
On the stomach you
Yes.
put it? Is it warm?
You can put it anywhere, truly. You can put it on the stomach. You can put it over the pelvic and uterine region. You can put it over breast tissue. You can put it over thyroid. So there is a company, a colleague of mine, her company is called Queen of the Thrones. She uses all non-toxic materials to make it safe and easy. So it's something made of flannel with a little apron, so it's easier. You tie it right around you. So we spoke about biofilms. Castor oil has been proven to literally break down these biofilms. So
Tell us what biofilms is, because
Yes.
we didn't get into it
Sure.
enough with one of our other speakers.
sure. So, the body is so wise. It is very smart. But these things that we're dealing with all day long, these toxins, whether it's heavy metals, viruses, bacterial spirochetes, all this, they're also pretty smart, and they take up shop in different areas of our body. And essentially a biofilm is just like a phlegmy little mucoid plaque that lives anywhere. I'm talking right now about the intestines, but it will hold the parasite, the virus, and the Lyme-related co-infections inside of it so that it evades our immune system. So this is how we call these things opportunistic infections, kind of stealth infections, because they hide out and they just take over when you undergo a severe trauma and you're shocked. If you are under severe stress, if you got a new infection, they can wake up and kind of take over. So that's the biofilm, is essentially like the little house where they live. So placing the castor oil over any region will just help encourage kind of opening them up, breaking them down. So then these little critters have the opportunity to leave. So over the thyroid gland for health and also throat support, over the belly for any IBS and intestinal issues. I've had women, in between their screenings for breast-related issues, do castor oil over the breast, and cysts and lumps and bumps can actually shrink, and they do, and you see it. I've seen also in the uterine and ovarian region, things disappear.
What about the small intestine or the small bowel, which seems to be, I was shocked to know that when you do a colonoscopy, endoscopy, it doesn't go there. Mm-hmm. It remains an enigma until something could be seriously wrong.
Right.
So how can we, kind of try and bring the small intestine into optimal health? Obviously, it's got to be done, I don't know how.
Yeah, no, it's a great question. I focus on the gut. I think Dr. Tony also mentioned it's the gut everything connection. So when we look at everything from a disease paradigm, we get easily overwhelmed. We don't know where to start. If we look at it from a healthcare paradigm, you start with the gut. Just, you're not going to go wrong. So we spoke a lot about food and reducing your toxic burden so that you don't promote leaky gut. There's, of course, testing out there where you can do genetic things. You can look at the different food intolerances. I do an acupuncture technique called NAET, which is an allergy elimination technique where you reduce inflammation from foods. So you actually help build up tolerance to the things that you're sensitive to. It's great for allergies. It works for anything under the sun. But so ways to basically simultaneously reduce the inflammatory burden. Castor oil packs is great for that. I do botanical medicine, so both Chinese herbs and I think you mentioned, was it lemon balm that you said, or holy basil? Yeah, so many different herbs are actually broad spectrum antimicrobials for the small intestine. It's a lot of clinical, just talking with the patients and understanding how they're feeling. They shouldn't be bloated. They should be having multiple normal bowel movements. And so bringing the small intestine is extremely important, as you're saying, because that's not where they're looking. So there are things you can do, tests you can do to look for small intestinal bacterial overgrowth. It's also just extremely common. It's the primary cause of IBS. The vast majority of human beings out there probably have some version of it just because of how we eat, what's in our food. So there are ways to even treat it presumptively. So with these herbal protocols or these at-home things. So to talk about water, just alternating temperatures, going back and forth, hot and cold. We see a lot now with the cold water plunges and all this, but packs over the belly. A vinegar pack can pull a person out of acute abdomen, interestingly. So if
What's abdomen?
Abdomen, if their abdomen is acutely inflamed or painful, that's something to do just to bring things down. So the old time naturopathic doctors came out of Baden-Baden and a lot of these other indigenous, as you're mentioning, techniques to practice at home self-care, which is really, free for all of us. So that's great when we're up against, how do we get the test? Who do we work with? How expensive is it?
Yeah, no, everything old is new again, and we have to go back to learning self-care. Some of the old school ways that were closer to the natural world, everything has been given to us.
Yep.
We've evolved out of this planet. Obviously, whatever we need is already here.
It's already here. So this is a scale of consciousness I just wanted to show because it's really beautiful about this idea of frequency and the mind-based practices that we can do, and that it is a spiral. There's a red line kind of going through the center, and that is courage, right? So it's the pain, it's the difficulty, the symptoms we're experiencing that do inspire the courage, and then we can kind of spiral up toward healing. More of us are more familiar with spiraling down.
I don't know how to read this, though.
Yeah, so this is really interesting. This is from a Dr. David
Hawking.
Scale of consciousness. So in the lower, we have shame, guilt, apathy, grief, fear, desire.
So we're just looking in the left column.
We can start with the left column because this is a complex thing that brings together a lot of different things. It actually is a logarithmic scale energetically all the way up to enlightenment.
Right.
But then we're going to look at the predominant emotional state, our view of life, our God view, and the process we're going through. So we could do a whole day just on this chart, truly.
Yeah.
And that would be part of the key of helping people understand that emotions are not bad. They are weather patterns. We are meant to feel them, and they are meant to move.
And lean into them.
We have to lean into them. And it's a spiral, not a straight line, because we know anxiety and fear and worry puts us in a downward spiral. But these upward spirals, actually, of positive emotions oppose the downward spiral of negativity. And even though you're hitting the same problem again, you have more wisdom and more experience as you go up.
I love that.
The higher states of being are really incompatible with physical illness and disease. So that's what I really wanted to take home, and it's been mentioned in many different ways today that as we start to have faith in ourselves and our body's ability to heal itself, and our cells pick up that information, it's much easier to release all of these toxic things we've been talking about, so we don't have to feel overwhelmed. Well, like, where do I start? What do I eat? Where do I shop? All of that. Like, as we practice these things, when lightning strikes, it actually cleanses the atmosphere. It grabs particles from the sky and it helps rain them out that are toxic. So the healing power of nature is in front of us at all times. And if we observe that, that's actually what the ancient indigenous cultures did do. That's how they learned about the mechanics of our own body, was through watching nature. So I think we're probably just
good.
out of time. We're good.
Yes,
So,
but thank you for being mindful of that. But
yeah.
this has been a real, I mean, you're a dynamo, you're a star.
Thank you. Well, this one's for you. Because the scars you share become lighthouses for other people who are headed to the same rocks you hit. And that's everybody here. And that is definitely you. As I read your book, I mean, your ability to openly speak about the trauma that you went through, and to so candidly, and vulnerability is what inspires love again and courage. And if we aren't honest and we aren't vulnerable, then we're still suppressing something.
True that.
That's the key to the emotional part of healing. We have to be honest.
Yeah, show your soft underbelly and
you have to show,
keep
which
it real.
is my next slide, the soft underbelly.
Cool.
I found this. I think it's awesome. So JOMO is the joy of missing out, not FOMO. It's feeling content with staying in and disconnecting for self-care. So I hope you all get to do that sometime today.
Oh, thank you. Thank you so much.
Yeah.
JOMO.
JOMO.
I'm gonna remember
FOMO.
that. Better than FOMO. Well, you're great. Thank you so much.
I'm just honored. Thank you.
You did great. Thank you. And that concludes this Masterclass Health Summit. I want you to go home thinking about what you learned today, what moved you today, how you can take control of your body, how you can pivot your thinking. It's a work in progress. It's a daily practice. Never think that you're going to get to that place where you're done. You're never done. You just have to always keep pulling yourself back to the center, pulling yourself back to positivity, pulling yourself back to spirituality and kindness and, self-love. And just honoring your body, honor your body. If I say that once, I say it 10 times a week to different people. Don't let your mind be the worst roommate in this house, because it tends to be very egocentric. Listen to the different parts of your body. If you're tired, lay down. If something hurts you, address it. Don't deny it. Don't defy your body. Support your body. Love your body. Be in gratitude to your body. And help it always work at an optimal and heal, because we were given that by nature. And if we don't let all of this 20th and 21st century bullshit infiltrate what we intrinsically know to be true, we will be much better for it. This is what we do. We take you and try and activate, motivate, and educate you to live the best life that you can. So remember, come back next time we have a Masterclass Health Summit, because we'll always be bringing you new cutting edge and exciting information so that you can live your best life. Thank you so much, and God bless. Mwah, mwah, mwah.